Again with the latest on the pandemic, and in the last 2 months, the average number of COVID cases per 100,000 people in Fresno County increasing more than 2,000%. That increase putting a strain on local hospitals. Medeiros Babb joining us live from CRMC, where staffing shortages are causing longer wait times for those trying to get into the hospitals. Medeiros.
Stephanie, Fresno and the rest of the Central Valley really feeling the impact of the current surge, with some patients waiting 2 to 6 hours in ambulances before they can get into the emergency department. And while healthcare staff from across the state are on their way to help, Fresno's top doctor saying that for some patients, it's too late.
This is a 20-something-year-old lady, and she made a mistake, and she deserved a second chance. She deserved just the mercy of at least having the chance to recover.
While presenting to the Fresno County Board of Supervisors, Interim Health Officer Dr. Rais Vohra, who also works with poison control, says he recently got a call of a woman needing a life support machine after overdosing on her antidepressant medication. Tragically, none in the county were left.
There was no bed and no machine to offer. And that's not even a COVID case. That's an antidepressant overdose case, and yet that person didn't get what we would call the full-bore standard of care.
Over the last 2 months, COVID cases surging in the valley. On July 12th, the health department reported 1.8 positive COVID cases per 100,000 people in Fresno County. Now, less than 2 months later, there have been 42.3 COVID cases per 100,000 people, an increase of over 2,000%. Staffing, by far the biggest issue for Valley hospitals due to staff quarantines and an already underserved healthcare system. Fresno Emergency Services Director Dan Lynch comparing the current COVID surge to a battlefield.
In the middle of the war, when we're all screaming for help, we did reach out and they said, okay, we're going to have to find somebody.
The good news, Lynch says, after 2 weeks of pleading with the state and other hospitals across California, a few dozen traveling nurses are arriving locally this week.
So we're actually hoping to see some change in staffing, or some relief, if you will, at some of the hospitals today, because a lot of those bodies are now coming to the hospital for assistance.
Vohra did recommend to the county officials that they look into offering incentives for businesses that have high rates of vaccines and are requiring masks for employees. He says to maybe do that through grants. And Vohra also said that the county should consider possibly doing a mask mandate, but most of the supervisors say that's something they will not consider. Reporting live from downtown, Medeiros Babb, KC24, local news that matters.